Malaria? Imagine waking up with a headache, intense chills, body aches, and a fever. You might think it's the flu. But if you've recently traveled to a malaria risk area, there's another possibility you should never ignore. Malaria. And here's what makes it dangerous. Symptoms can begin days, or even much later, after a person has been infected. In this video, we'll break down the warning signs of malaria, how it spreads, who is at risk, how doctors diagnose it, and what you should do if you suspect you have it. Malaria? Don't ignore the warning signs. What exactly is malaria? Malaria isn't caused by a virus or bacteria. It's caused by microscopic parasites called Plasmodium. These parasites are transmitted primarily through the bite of an infected female Anopheles mosquito. Once inside the body, the parasite eventually infects red blood cells. And that's when the classic symptoms can begin. Why malaria can be missed? One reason malaria can be missed is that its early symptoms may look like many other illnesses. Fever, chills, headache, muscle aches, extreme tiredness, nausea. These symptoms are not unique to malaria. That's why your travel history can be extremely important. Warning sign number 1. Fever. The first major warning sign is fever. The fever may come with episodes of chills and sweating. Some people experience recurring episodes that can become severe. But don't wait for a particular fever pattern before seeking medical attention. Malaria can present differently depending on the parasite species and the individual. Warning sign number 2. Chills and sweating. Another classic symptom is a combination of chills followed by sweating. A person may suddenly feel extremely cold, even while their body temperature is elevated. Later, the fever may break and heavy sweating can occur. This cycle can be frightening, but the important point is that malaria can progress quickly in some people. Warning sign number 3. Headache and body aches. Severe headache and body aches are also common. You may feel as if you have a serious flu. But when these symptoms appear alongside fever, especially after travel to an area where malaria occurs, you should tell a healthcare professional. Warning sign number 4. Nausea, vomiting and abdominal symptoms. Malaria can also cause nausea and vomiting. Some people experience abdominal discomfort or diarrhea. These symptoms can make malaria even harder to recognize because they overlap with common stomach infections. The travel question most people forget? Here's an important question. Where have you been recently? Malaria is uncommon in the continental United States, but travel-associated cases do occur. If you've recently returned from a region where malaria is common and you develop a fever, tell your healthcare provider. Do not assume that being back in the United States means malaria is impossible. WHO is at higher risk for severe malaria? Malaria can become severe, and certain people are at greater risk of complications. That includes young children, pregnant people, travelers without immunity, and people with certain health conditions. But severe malaria can happen to anyone, so worsening symptoms should never be ignored. Emergency warning signs? Now pay close attention to this part. Severe malaria can affect the brain, kidneys, lungs, and other organs. Emergency warning signs can include confusion, seizures, difficulty breathing, severe weakness, loss of consciousness, jaundice, or signs of serious organ problems. If someone with possible malaria develops severe symptoms, urgent medical care is needed. How doctors diagnose malaria. Malaria cannot be reliably diagnosed just by looking at symptoms. Doctors use blood testing to look for the parasite. Depending on the situation, testing may include microscopy or rapid diagnostic tests. If malaria is strongly suspected, repeat testing may sometimes be necessary because parasite levels can change over time. Can malaria be treated? Yes, malaria is treatable, but treatment depends on several factors, including the parasite species, where the infection was acquired, how severe the illness is, and whether the parasite has resistance to certain medications. That's why malaria treatment should be guided by a qualified healthcare professional. Self-treating with leftover medication is not a safe strategy. Prevention? If you're traveling to a malaria risk area, prevention matters. Depending on your destination and personal health situation, a healthcare professional may recommend preventive medication. Mosquito protection is also important. Use an EPA-registered insect repellent, wear protective clothing when appropriate, use screens or air conditioning where available, and consider sleeping under an insecticide-treated bed net in suitable settings. The biggest mistake? One of the biggest mistakes is assuming it's just the flu. If you develop a fever after returning from a malaria risk region, malaria should be considered, even if you feel like you simply have a viral infection. Tell your healthcare provider about your travel history immediately. Remember these 4 things. Malaria is caused by a parasite. It is mainly transmitted by infected Anopheles mosquitoes. Fever, chills, headache, body aches, and gastrointestinal symptoms can occur. And after travel to a malaria risk area, an unexplained fever deserves medical attention. If you found this information useful, subscribe to PHUD Doctor USA for evidence-based health explainers designed to help you understand important medical topics before they become emergencies.